Professor of Radiology and E-Curia at Macquarie University. He's founder, member and director of Ernest Cook Ultrasound Research and Education Institute. He was part of the WHO Guidelines Group for COVID-19 and he's chairman of AFROSAFE South. Thank you, Michael.
Thank you, Karen. Good morning. This morning we are going to look at the role of the radiographer in ensuring safety at MRI. This presentation was made by one of our radiographers, works with us but also works in the UK, and a little contribution from myself. So yes, we hope to understand the safety aspects, understand the need for proper patient screening, the dangers, contraindications of MRI, and the need for proper patient evaluation before contrast injection. Patient management. Of course, an appointment has to be made. The examination has to be explained to the patient, how long it takes, how they should dress, what they shouldn't have on their bodies, the contraindications. Screening for metallic objects is the role of the radiographer. Checking accessories, gadgets, devices on the patient, and advising position, the position the patient should maintain when in the MRI machine. Safety aspects include, of course, projectiles, patient management, biological effects, static magnetic field, peripheral nerve stimulation, acoustic noise, radiofrequency energy, and of course the liquid helium, which many of our MRI machines have. The biological effects of imaging of the magnetic field. There are effects which are related to the magnetic field, these are static magnetic fields related to the static magnetic field, to the dynamic gradient fields, and also to radio frequency. The bioeffects of static magnetic fields. This has been known since the 1980s. The general effect, fatigue, central nervous system effects like dizziness, GIT, metallic taste, loss of appetite, and the cardiorespiratory, chest pain, and the skin. But these are short-lived, and there's no scientific proof that they go on or they have any long-term effects. And they are more severe at higher field strength, and the effects are subjective. Some patients have them, others don't. The effects of the static magnetic field. All MRIs have a static magnetic field, and one of the effects we should watch out for are the forces, especially on metallic items. You can see these are real accidents which have happened, which we have people have experienced in some MRI facilities, and so care should be taken because this field is always on. Peripheral nerve stimulation, PNS, the patient may feel tingling sensations on the skin, and this varies patient per patient, and they largely depend on the gradient axis which is used, commonly in the face, but also in other parts of the body. And so what's important here is to inform the patient. The radiographer should inform the patient that this may happen, and also ensure that the conductive materials or the conductive parts of the body don't touch each other, so you don't cross your feet or clasp your hands. Acoustic noise, this is due to the time varying of the gradients. The time varying is one who creates that irritating acoustic noise. And so this should be controlled. It's measured in decibels, but one should ensure that you control it to within allowable limits. The higher magnetic fields produce more noise. And that noise is not only exposure to the patient, but also to the occupational workers. And so it's allowed to have 99 decibels. 140 decibels should not be exceeded. And the limits for occupational workers may be specified according to the country where you're working. Radio frequency energy. Radio frequency energy causes the heating effects which happen to the body, to the patient when they're in the MRI machine, and the temperatures certainly rise. There is what they call the specific absorption rate, and that's what is key in this. It could be actually compared to a microwave. And so there is deposition of energy into the body, which is due to the radio frequency. And so the SAR, which is specific absorption rate, is equivalent to the mass normalized rate at which the radio frequency power is coupled to biological tissue and is indicated in units of watts per kilogram. So there are organs in the body which are more prone to heating, like the testis and the eye. So to manage this, avoid heating by more than 1 degree centigrade. The exposure should be limited to volume close to the transmitting radio frequency coil and not beyond. So you should limit the exposure and not expose the whole body. Relevant for patient and intervention. This is something which is very important because if you're doing an interventional radiology procedures in the MRI room, then you can also be capable of heating up because of the radio frequency energy. And so there are things you should do to prevent burns, placing spacer pads, avoiding focused skin-to-skin contact, advising the patient that they should feel if they feel any discomfort or heating, then they should press the buzz alert for the staff to know. They should wear few clothes as possible to allow cooling, and larger patients are more prone to heating up, and the room and bowel conditions should be well maintained to encourage patient cooling. There should be cooling, good air conditioning within the room. That picture shows using pads to prevent the burn effect. So you can reduce this by increasing the tiara, reducing the number of slices, reducing the flip angle, lowering the BI amplitude, and less or lower degrees of radio frequency pulses. SR hazards are worse with metallic leads, like the antenna, or any items which may have an antenna effect, and wires should be straight, no loops. If they are looped, then they can create an antenna effect. Those are thresholds, safety measures, patients sensitive to temperature increase. These are patients whom we should take precaution as they are getting to the MRI room. Those who are sensitive to temperature increase. If a patient has fever, we should take precaution. Cardiac arrest, risk of cardiac arrest, patients with seizures or claustrophobic, and also patients who have impaired perspiring ability, especially the obese, the unconscious patients, the heavily sedated patients, the confused patients, and also those ones who may have gypsum or plaster on their bodies, plaster casts on their bodies. We should take precaution with all these patients. Prosthetic heart valves, clips, surgical clips, insulin pumps, joint prosthesis, metallic splinters, pregnancy, and patients with patches. All these are a risk. And we should also talk about magnetic quenching, because when it happens, it may be a shock to the patient. The quenching is very fast evaporation of the liquid helium, and may result in lack of oxygen for the patient, and the temperatures may suddenly drop for the patient. And this can be quite dramatic, and the patient may be shocked by the event. So contrast agents, we all know that we use gadolinium as a major contrast here. And so we should watch out for severe reactions and mild reactions. We should avoid contrast for pregnancy in patients who are pregnant, but also in those ones who are breastfeeding. They should not breastfeed after a contrast injection at least for 36 to 48 hours. Otherwise, the baby takes this gadolinium into their babies. And so safety first. We should know that as technologists, even as we work, we want to produce good images, but safety is key. Thank you, Mr. Chairman.
Thank you very much, Michael, for a wonderful presentation. Our next speaker